Good afternoon, everyone. I am Dr. Jen Lacey-Nichols. I'm in the Center for Health Equity. I am your guest chair for today. I am sitting here at my desk, which is on beautiful Wurundjeri country. Sovereignty was never ceded, and I would like to pay my respects to elders past, present, and emerging. We have a very interesting and topical presentation today, talking about some of the findings from a large NHMRC collaborative project, which I'll let Simone and Paula talk about. But we're joined here with Paula O'Brien and Simone Pettigrew. Paula is from my university. She's in the Faculty of Law. And she's here today to chat about wearing, I guess, her regulatory hat, looking at how harmful commodities are regulated and what's the sort of the role of law in perhaps influencing how we can make all of that a bit healthier. She also she chairs, sorry, the WHO's Europe Technical Advisory Group on alcohol labeling, which I believe she's going to be doing some work for later this month as well. She did say something about WHO. And we also have Simone Pettigrew. She leads the Commercial Determinants of Health team and the Food Policy team at the George Institute for Global Health. And her background is in the economics and commerce space. So really sort of bringing a very interdisciplinary lens to this question of alcohol labeling and sort of the labeling and regulation of harmful commodities more generally. So we will have a bit of back and forth presentation from Paula and Simone, and then we've left ample time for questions at the end. So please think of interesting questions. You can always pop them into the chat, or we're a pretty small audience today, and I think hearing voices is always lovely. So by all means, you can pop your hand up. If you put something in the chat to just signal you want to ask a question, I'm happy to call on you later when we get to that. And if you don't have any questions, I have 4 already because I got a sneak peek at the slides and they're very interesting. So on that note, I will hand over to Paula, who's going to give us a bit of context setting. Thank you.
Thank you, Jen, and thanks for chairing today. We really appreciate it. So thanks everybody for joining us today. And so we're really grateful for you being here, and we hope that we're going to have a really good discussion. So the seminar today is about Simone and I reporting on a project that Simone leads and that I've been very fortunate to be involved in for the last few years. It's an NHMRC funded project, and it's called the Alcohol Industry Monitoring System. We're coming to the end of the funding. We still have lots of papers flowing from the project, and it's been a very hugely productive project under Simone's really outstanding leadership. So thank you, Simone. It's been a wonderful team that we're working with. And so we've put everybody's names on the slides here, and people have contributed a lot to the research that we're going to talk about today. So the presentation is divided into 3 parts. And the first part I'll handle where I'm going to talk about the regulatory context for alcohol labelling in Australia. And this context really is the background to the project. And in many ways, we're interrogating the working of this regulation that I'm about to talk about. The second part Simone will handle, and she'll talk about the AIM studies that we've completed and that are in the public domain, and flag the other projects that are still underway or where there's papers under review that we're not talking about the results yet. And in the third part, we'll go back and forth a little bit and talk about the policy and regulatory implications of our studies, the results from our studies for the future of alcohol labelling in Australia, but also more globally. And we think that some of the things that we've found provide lessons for other countries beyond Australia. Okay. So turning to the first part of the presentation. So this regulatory context is all about alcohol. And I know we have a very informed audience about alcohol as a commodity, but I just want to try and bring some of this background about alcohol as a commodity to front of mind. So alcohol is a psychoactive substance, as you know, but it's what's being called an ambiguous molecule. And I think it's an interesting term because it's a commodity that has lots of different meanings and different uses in our society. So whilst it's a drug, it's a legal drug, and it's also a foodstuff, so it's got this kind of, it sits between drugs and food. And I think some of that ambiguity about what it is actually feeds into some of the challenges around regulating in this space, including with alcohol labeling, which we'll focus on. But I think it's really important to remember the harms associated with the product. So it has been considered to be the most harmful of all psychoactive substances. And so that ranks it ahead of tobacco, heroin, and crack cocaine, because once you take into account the harms to others from alcohol and not just the harms to the person drinking, you actually see something quite different about the effects of this product on the individual and on the population. It's linked to more than 200 diseases, and probably different harms are coming to mind, but I just want to plant a few again at front of mind because these will connect to the kinds of things that we're specifically talking about. So it's linked to 7 types of cancer, of heart disease, fetal alcohol spectrum disorder. So it's the only cause of FASD, and a disease which is not curable, and so only affects the fetus through exposure to alcohol in utero. It's also connected to a whole range of injuries from, of course, street violence. So we think about crime, but also family violence and road accidents. And it's connected to mental illness, and not just in terms of alcohol dependence disorder, but the range of mental illnesses that affect our society. So 4.1% of the burden of disease in Australia is attributable to alcohol consumption. And a lot of that is skewed towards men from 15 to 45. So we're talking about a substance that has a significant harm profile. That harm comes from the consumption, and people and the industry often like to talk about declining consumption. And it's true that consumption has declined. It's ticked up again recently since COVID. But it's really important to remember that about 1/3 of people who drink actually drink at risky levels. So by that, we mean in excess of the Australian drinking guidelines, which are no more than 4 drinks on any drinking occasion and no more than 10 drinks per week. So, we have about over 30% of the population drinking in a risky way. So this is the product that we're talking about. And government has lots of different levers to press to try to reduce harm, and reduce harm through reducing consumption. And the 3 best buys are pricing measures, restrictions on availability, and restrictions on advertising. But another good option is through labelling and provision of information to consumers. And so that's the policy and regulatory response that we're going to hone in on today. And so if we talk about the labelling of alcohol products to provide information to consumers, there can be different objectives for the provision of that information. And I just want to spell out these objectives because they do have implications for how you might label alcohol products. And these objectives are not always consistent with each other as well. They can generate tensions. And so one of the first and most basic objectives is to respect and fulfill a consumer's right to information about what they are ingesting into their bodies. And this objective very much recognises the food aspect of alcohol. So like we want to know what's in and foods that we ingest and what are the harms they pose to us. So with alcohol, consumers should also know about what are the risks associated with that product. The second objective sort of flows from that, and that is to enable consumers to make informed choices about their alcohol consumption. Now, the first objective about the right to information doesn't actually depend on a consumer doing anything with the information. It's just a simple and a bare right to be given information. Whereas the second objective is about consumers making some use of that information. And they could make use in a good way or they could make use in a bad way, but they actually got the information they need to make a full, voluntary, informed choice. The third objective then kind of flows on, and that's about using that information to change consumer behaviour with respect to alcohol consumption. So that's actually seeing the information as a way to actually shape the way individuals and the population act. And what I want to emphasize about that objective is that it's not that the consumer sees the information and in that moment changes their behavior. It's a complex process of receiving information that ultimately feeds through into behavior change. And there might be a very long timeline between those two things. And I would say, I think this is the industry tries to emphasize that information doesn't produce behavior change because they look at this, they look for this very short timeline. And then finally, and this is something that we've learnt from tobacco, is that consumer information, public health oriented consumer information on alcohol products also helps to counter industry marketing on the product. And I'll just, the next slide shows you, this is all the type of alcohol we see. And because the alcohol product itself is a form of marketing. So beyond all the billboards and what we see on TV and what we see on our phones, the product itself is a form of marketing, both what is actually consumed, but also the packaging and the labeling. And you can see, a range of beautiful colors on the screen, interesting fonts, really nice artwork, interesting bottle shapes, and all of those things actually serve promotional purposes for the industry. And so one potential objective of consumer information on the product is to counter some of these promotional gains that the industry makes through its products. Okay, so they're the potential objectives that government can adopt when deciding to pursue alcohol labelling. So what's the labelling situation in Australia? So alcohol labelling law in Australia is sort of a complex thing, and that's because making alcohol labelling laws is not as simple as making legislation in one jurisdiction or making a regulation under legislation in one jurisdiction. It's actually what I call a sui generis or unique Australian and New Zealand system. And so Australia and New Zealand make food standards together, and that includes labelling standards and that includes alcohol labelling standards. And there's also a two-step process, and one is, and I'm just going to roughly call it like a scientific process that's run by Food Standards Australia and New Zealand, and a food standard is drafted by FSANZ. It's an evidence-driven process with matters of public consultation built in. It's a long process, and it is a very detailed and exacting process. And whilst I call it scientific, I don't want to also overstate that there are political aspects to that process. But that doesn't make a food standard. A food standard is then only made once that draft standard is sent by FSANZ to the Food Ministers meeting. And the Food Ministers meeting is made up of 10 decision makers, a representative from Australia and New Zealand and from each of the states and territories. So no one jurisdiction in Australia owns alcohol labelling as a matter, and no one jurisdiction can really move on its own. They have to actually basically move en masse, or at least in majority. There can be back and forth between FSANZ and the Food Ministers meeting, and I won't go into that, but I've simplified this process onto the screen. Okay, so what has this complex regulation making process produced for alcohol? And basically what we have so far in terms of labelling requirements are, of course, basic information about the producer name and address, allergen information, and then we get to sort of the more public health oriented requirements, and there must be alcohol content included on the product label, standard drinks information. So Australia is one of a very, very small number. I think it might be 2 or 3 countries in the world that requires standard drinks information, and you're probably all quite familiar with that little standard drinks logo there. Now, Australia has also mandated pregnancy and alcohol warnings, and it's our only mandated alcohol warning on alcohol products. And I just want to tell you a little bit about it because this is a big focus of our AIMS project. And so this is considered a real public health success story. And I think that's quite a valid description of it. There's been very little positive movement around alcohol regulation in Australia, really, for a long time now, and this is one of the exceptions to the rule. But I also want to flag that whilst it is a success story, it was very hard won, and it was not a win that came without cost to FSANZ and to various people who work within FSANZ and to politicians around Australia. So the pregnancy label only came into effect on the 1st of August 2023. It had been preceded for about the 10 to 12 years before that by this industry voluntary label that you can see on the right-hand side of the screen. It's the DrinkWise Get the Facts label, and it's safest not to drink while pregnant. You can see it's green in colour, and I just want you to note the terminology. It's safest not to drink. So the safest thing is not to drink. So the industry had convinced the Commonwealth government that the Commonwealth didn't need to act to mandate pregnancy and alcohol warnings because the industry would handle it. And they promised 100% compliance within a couple of years. Now, this was a mistake, I think, that the industry made because they couldn't get 100% compliance. And that lack of success of the voluntary label then led the Food Ministers meeting to decide to act. So in 2020, the label on the left-hand side of the screen became into effect in law, and there was a 3-year transition period from 2020 to 2023. Now, this mandatory label basically only applies to products labelled after the 1st of August 2023. So anything that was on the shelf or that was already labelled on the 31st of July 2023 does not need to be relabelled to show the pregnancy warning. The rule does set down mandatory text and design requirements, including size. So there's some really important features. You'll see the colour, you'll see the border, the use of red is really significant, but there's no requirement in the legislation, in what is now the regulation, around where the warning is to be positioned on the product. And so our studies speak to that. And there was also some winding back of the standard to allow for just black and white versions of the label on corrugated cardboard outer layers. Okay, so this is our really big win in terms of alcohol labelling in Australia. There is a new alcohol labelling requirement that will come into effect from the 13th of August 2028. This is very, very recent, so only made this year. And this is to mandate the provision of energy information by serving, you'll see there, and by 100 mils on alcohol products. And this has been an extremely controversial development because of queries about the way consumers actually use this information. And so one of our studies also speaks to this. The alcohol labelling rules also set down restrictions. And so there's prohibitions on health claims about alcohol. Alcohol is good for you, alcohol is good for your bones, alcohol is good for your heart. So those claims can't be made on the product. And there's also prohibition on nutrition claims about alcohol, except for certain nutrition claims, and those about energy, carbohydrates, sugar, and gluten. I'll just take you to the next slide. So the industry is very much using this allowance that's been included in the regulation to include many many nutrition claims around energy, sugar, or carbs, and to a lesser extent gluten on products. So thanks to Simone for these images. You'll see the highlighted boxes, so 70% less carbohydrates, low carb, zero sugar, zero sugar. So this allowance in the regulation has certainly been used by the industry. I did want to flag that many claims and I'll just call them health-related claims broadly, so not health claims as defined under the regulation, but health-related claims about products being natural, using fruit, being organically processed. A lot of these types of claims are not regulated at all by FSANZ. And of course, they're regulated under the general consumer law. They must not be misleading or deceptive in any way. But there's a lot that the FSANZ food standards don't actually speak about, that a lot of matters that are actually seen on alcohol labels, but they're not regulated in any way. So that is the regulatory background. I'm now going to hand to Simone, and she is going to talk us through the AIM studies. Thanks, Simone.
Many thanks, Paula. That's a great background and nice to see some familiar faces out there in the audience. So the AIMS whole process had three major methodological approaches, and the big kind of one that we've been working on across all 3 years today is these retailer audits, and I'll explain those a little bit more to you in just a moment. We've also run focus groups, and we've done several consumer surveys as well. So with our retailer audits, we've sent these poor souls actually into alcohol stores, and they go in there and they take photos of every side of every product on the shelf. Now, this is pretty much replicating what we already do at the George Institute for Food. We have an app called Food Switch, and that's based on these data that are also generated by people going into stores and taking photos of every side of every product. So the AIMS project brought that same methodology into the alcohol domain. Just as we were bringing it in, though, we started to have problems with some retailers, and that was across both the food and the alcohol space. So interestingly, the Woolworths chains have allowed us to keep coming in store, and the Coles owned chains are not. So because of that, we also web scrape a lot of data, and you can see on the right-hand side there, that's kind of indicating the process that we use there. And that's just dragging down information from websites that are getting better at providing images of different sides of products, but still nowhere near as good as the data that we get by going in store. Going to use this lovely little product here as the example to work through to show you what kind of data that we generate through this process. And it never ceases to amaze the extent to which industry can blatantly target youth as they do in this particular product. And they have a terribly watery, ineffective ABAC code that is supposed to prevent stuff like this, but as you can see, it completely does not. So this is this Mex cream liqueur with tequila product. So when we take a photo of the front of that, we get the basics, the mandated information that Paula mentioned, like the volume, the percent alcohol. We capture the product name, the product description where it's there. But then we start to get some of the interesting stuff that they use to convey information without actually doing things that they can be pinged for in the regulation. So for instance, where they use human or animal pictures or features, and where they use nature to indicate that the product might actually be quite natural and healthy for you. And looking at the back of the product here, again, loads of information for us to extract. So where they provide ingredients, we get that, the country of origin, right down to the packaging, recycling information that they've got, and every single different kind of warning that they might put on pack, we include as well. And then increasingly, we've been looking at the claims that are appearing on pack. So we actively go looking for those. Where they do make claims, they will often use this nutrition information panel. So we've been catching that, and we will be looking at the implementation of the new energy label that's just been mandated, as Paula mentioned too. And we've been, in more recent times, also looking at the use of QR codes. So it's quite a good news story. Sorry, it's a little bit small there, isn't it? But if you look down at the volume, alcohol, standard drinks kind of prevalence on all of the products that we collected, and this is for the year 2023, so almost 6,000 products, it's high. It's like 99, 99, and 97% compliance with those really well-established, regulated, mandatory pieces of information. So that's good news. And it gives us the message that we really do need to mandate things to make sure that they get really good coverage. The 86% of pregnancy message there is just any kind of pregnancy message. So it could have been the mandated one, or it could have been the DrinkWise one that Paula showed you just now. And so that's only at 86%, and I'll break that down more for you in just a moment. And then we also captured these bunch of other voluntary health messages that they pop on, things that can mislead consumers into thinking that alcohol is actually a healthy product. And if we look at this broken down by specific product categories, we can see that for the mandatory ones, they're all pretty good, but standard drinks kind of drops a bit relative to the others and for the spirits category. So it's only 96%. And just anecdotally looking at those, it seems that they typically happen on imported products. So we kind of need to get a bit better at monitoring and enforcing products as they come over the border. And for the voluntary health messages, you can see they vary quite a lot between different kinds of products, as does the pregnancy message, but not quite so much. But you can see that cider and premix products are up there at 90 and 95%, which is kind of good because they're products that would be targeting younger people. But again, unless it's the mandatory one, then they're not really doing the right thing. Here are some examples of products that we identified out there for sale that are actually missing mandatory information. So these ones, for instance, this product does not have a volume amount on it when it's required to. This next one, it looks like they meant to put the ABV in, the alcohol by volume, but didn't quite get around to it. And then here's this lovely imported product that made no attempt to put any kind of standard drink information, despite having quite a lot of other stuff on there, as you can see. So ducking now down to the next little table underneath. So we then started to pull apart, well, what kind of health messages are there on there? And you can see that this is in 2023, at the point at which the transition ended, 2/3 of products almost had a pregnancy warning label, the mandatory version, but 1/3 still did not. So this is 2023. It was regulated in 2020. They had a nice, generous 3-year period. 3 years on, still got 1/3 of products out there that don't have a mandatory pregnancy warning. And it comes back to that little wiggly condition they had where they were only forced to put it on at the point at which the product was labeled from that 3-year point onwards. And then you can see with the voluntary health-related messages there that the drink-wise messages are really still quite prevalent out there as well. The other thing we looked at is for the first year of data collection, which was 23, when they went into store, you probably remember from the image earlier, but there was a little white box that they put the product in that gave us really good lighting, but it also had a ruler, a vertical ruler standing up. And we were able to, through that ruler, determine whether or not they were complying with the requirements, the size requirements for the pregnancy warning label. And blessing Asad Yusuf, who is the poor PhD student who got to spend a lot of time using software to measure actual examples of those warning labels. And when we only looked at products that had the mandatory warning label, 89% were compliant. So that's just over 1 in 10 didn't manage to put it on right. And that was for various reasons. They were supposed to put a larger version of the warning on larger products, and quite a few of those larger products didn't. They stuck with the smaller warning. And just before we switch over, if you can see their spirits again is the most non-compliant one. So it looks like that's an area that we kind of need to be focusing more on. And here are some examples of non-compliant pregnancy warning labels. And you can see that they pretty much have the effect of reducing the salience of the pregnancy warning label. So the one on the left doesn't have a black border to make it jump out, and the one on the right doesn't have the white background that it's required to have. We also looked at whereabouts on the products they put the mandatory pregnancy warning label, and I'm guessing you would have all assumed that none of them were going to put it front and center on the front of the pack, and you would have assumed correctly. For the single unit products, 92% of them put them on the back and 8% of them put them on the side. So you add that up, it's 100. So nope, nobody's wanting to put it on the front. But the really sad story was that when we get to multi-packs, as you can see some examples there, 2/3 of them put the pregnancy warning label on the underside, on the bottom of the product. So you would have to lift it up and look underneath it to see it, which of course no one's going to do at the point of sale. So that's also indicating to us a really important area for future regulation is to be much more specific around where these warnings can and cannot be placed. We also then looked at products for which the data had been scraped. So if you think about the fact that they had that 3-year transition, online is different. Online, you can put a warning label overnight. You don't have to claim that you need all of this new repackaging time to do that. So we, at the very date on which that transition period, the 3-year transition period ended, we scraped these products, and a big shout out to Tasman Davies who did that work. And then you can see on the right side there, a lot of sites now you can toggle, you can choose to look at the back of the product, but as you can see there, it's often teeny tiny, so it's hard to see. But we were able then to tell whether or not the pregnancy warning label was on the front or the back of any products that were being sold online. You can see there for all products, it was a nice big fat 0 of them that had it on the front page when you look at it. And if you did swivel the product, it went up to 7%, on which when at the point of sale, you could see the pregnancy warning label. So what we've also been looking at is, well, perhaps they put it somewhere else on the page, and we haven't published these analyses yet. But let's just take the example of this vodka cruiser pack that's beautifully pink. So you would have to assume it's targeting some female audience members out there. And with those flavors, perhaps young women of childbearing age. So it would be very appropriate. In fact, they absolutely should have that pregnancy warning label displayed, particularly online where they've got lots of flexibility to do so. So this is the front page. And you can see there they obviously focus on the price and the fact that you can get a better price if you buy it in bulk. And they give you a star rating, 4.7 out of 5. So that's crash hot. It's looking very appealing so far. If you scroll down, you can then get these images of the different front back side. And you can see that, nope, it's not on the front back side. Perhaps it's on the underneath, but they do not put that image on the website. You then get some advertising material as you scroll down suggesting other products to you. Then you get these reviews from people, again, nice, hefty star ratings. And you can read some of those comments there. They're actually promoting excessive drinking there. So before you get any kind of warning, you're actually getting messages about the fact that you can drink a lot of this. We get more promoted products. We're still scrolling down the same page. Then we get to this bit here, which you would probably think would be the end, right? It's this kind of mandatory information or common information that you get at the bottom. And next slide, please. But if you do keep scrolling, you eventually get to this little point here with our teeny tiny little pregnancy warning label that again is not as to the mandatory standard. It's not meeting the different requirements. So these guys can tick the box and say, yes, we are showing the mandatory pregnancy warning label, or at least a variation of that, but it's certainly not anywhere that anyone is ever going to see it. Paula also mentioned the fact that this new energy information label, the top left there, has now been put into law in Australia and it will be introduced by 2028. So again, they've got a nice, lovely long implementation period. When we ran our focus groups and talked to people about energy labeling, first up, we just asked them about the concept, and there's general approval that yes, it's a good idea to tell people how much energy is in alcohol. And this was primarily from the point of view of weight control and people being, having the right to understand how many kilojoules they're putting in their body. But it was very clear that many people in the focus groups were quite confused around various aspects of energy. So one, just the concept of energy. So at least one or two basically said, oh, but energy is really good for you. It gives you the power to go off and do stuff. They didn't kind of understand the nuances of different kinds of energy. There was also a lot of confusion around kilojoules versus calories terminology. People were more comfortable with calories, which is a shame given that kilojoules is what we're supposed to use in Australia. But of course, you can guess the alcohol industry much prefers to put calories up because that number looks way smaller. Then also they got quite confused around what a standard drink is versus what a serving size is versus the 100 mils information. So although technically, providing all this information is ticking the information provision box, we also know that too much information just confuses people and creates aversion. They look away, they don't try and process it because it's too hard. And that was certainly the kind of response that we got from our focus group participants. And the other problem here is that we also talked to them about the other kinds of nutrition information panels that you see on products, particularly where they make a nutrition claim. They're required to put a nutrition information panel on. And you can see an example there to the bottom left. So there's lots of zeros in there, lots of really, really small numbers. And the kind of feedback that we got was, wow, look at that. It's glorified water. It's practically good for you. So there's real opportunity there to seriously mislead consumers by including that kind of information. In terms of what's coming up next, we've got a lot of survey data that we are still working through. We're looking at the prevalence of nutrition claims as well from the audit data. And that's both the explicit kind of claims that we've been talking about today, but also the implied claims. So things like all that imagery that they're using to communicate things and the really weasel words, we would call them, things like natural, organic, things that probably mean a whole bunch of stuff to consumers that isn't appreciated in the legislation. We're looking at the effects of nutrition claims, how they resonate with people, how they interpret those. We're looking at what happens when you put cancer warning labels on products. Does that make people second guess about how healthy or not alcohol products are? We're looking at the interaction between nutrition claims and cancer warnings. What happens? Do they water each other down? Does one of them overcome the other one? We're looking at prevalence of zero alcohol products in the market and consumers' responses to those. And Laura, who's in the room here, is actually working on a piece looking at how consumers would support or not various kinds of policies to restrict zero alcohol product advertising, for instance. And Emily, who's also in the room, is doing some work for us around looking at the kinds of nutrition claims on products and whether they actually meet requirements that would be in place if this was a food product. And I think that might be it, Paula, for me. Oh, sorry, a big thank you, a shout out to 3 amazing PhD students who've done the lion's share of the work that you've just heard about, Asad Yusuf, Bella Struley, and Tasman Davies, in alphabetical order because they were too awesome to rank any other way. Thanks, Paula.
Thanks, Simone. And so just briefly before we head into some time for questions and to hear from you, we just wanted to draw out some of what we see as the policy and regulatory implications of the findings from the studies. And we'll go back and forth a little bit here. So, Simone, were you going to start on the pregnancy warnings, or did you want me to do that one?
I'm completely happy either way. I'll give my voice a rest and let you go.
Okay. So, we've got a number of studies that we haven't spoken about today that are in progress, and we've learned a lot from the AIMS project about the pregnancy and alcohol warnings. And we think that we've got some really clear lessons for Australia for really alcohol and food labelling going forward, but that we think are generalisable to other countries. And really one of the key ones is that there should be a hard start date for any labelling requirement. So you'll remember that I've mentioned it and Simone's mentioned it. The pregnancy and alcohol warning only applies to products labelled after a certain date. And so there's a heap of product out there that was on the shelf before the start date. It's not easy on the products to basically tell if they were on the shelf before the start date. So checking for compliance is very hard. And so we would say there has to be a hard start date. And that hard start date for an alcohol warning label may need to be accompanied by a provision in the regulation that allows for producers or retailers to apply stickers of the warning to the product, and stickering in a food labelling context is actually quite common around the world. But we cannot have this situation where products are out there for years without the warning label on it, and we really don't know whether they're compliant or not. We think that 3 years, we've mentioned it a few times, the law came into force in 2020. The industry had 3 years to transition, and really that was we think just a delaying tactic and way too long. It was originally to be 2 years, but the back and forth between FSANZ and the food ministers meeting resulted in a 3-year transition period, and that really seems not to be needed, particularly if you're going to allow stickers. Basically, that's a very easy fix. We also think the position of the warning label should be specified by law in light of our findings about where the label is appearing, and particularly that really, appalling and cynical result that we've found that the label is put on the bottom of multi-packs, which is just absurd. And so that's an important thing for future labelling, and that really proper monitoring enforcement is needed. And the states and territories are responsible in this complex food standard system for monitoring and enforcement. And it seems like there just isn't the attention being given to this issue that it really deserves to ensure that the label does its work out in the community in terms of alcohol and pregnancy risk. Simone, would you like to comment on the nutrition claims and the energy claims?
Sure. Thanks, Paula. And we do understand, as Paula said, that it's a difficult task. So we're really asking individual states to go out there and monitor this stuff. And it's difficult because it's the state of production of the product is the one that has to do the enforcement. So it's a really messy thing. So pregnancy warning label is quite a straightforward one. Is it there or is it not? The whole claims thing gets even more complicated because it's not as well defined perhaps as it should be. So we need some kind of monitoring to be able to check compliance. And this is what the AIM study has been doing up until now for the last 3 years. And we're really hoping to be able to enable that to keep going into the future. And I think it also will help FSANZ understand the full extent of the different claims that are out there. And they're doing this review in 5 years to see whether or not the sugar and calm claim allowance that they have made, is that a good thing or is it not, in the context of all of these other types of claims that are out there? Is it just adding to the menagerie of claims? Should we really be clamping down more of those? And we also need some further research into how consumers are using the new energy information label. We kind of conserved our energy when, excuse the pun, well, when they were looking at this one, because claims is a much bigger issue in terms of the promotion of a product. Industry was quite keen on having the energy information label because they know that it really doesn't do anything. And we found that in our focus groups as well. People just like, yeah, too much information, too hard, not going to think about that at the time of point of purchase. But it will be interesting going forwards to be able to monitor that placement of those labels and whether or not consumers over time do get used to them and do start using them in their decision making.
Thanks, Simone. And so we just wanted to sort of end with, where to next. And this a number of countries around the world at the moment are contemplating cancer and alcohol warning labels. And so what you see on the screen there is Ireland's new alcohol health warning label. And it includes drinking alcohol. Oh, sorry, there's a direct link between alcohol and fatal cancers. So it's the first Anglophone country to mandate alcohol and cancer warnings. It was a huge policy fight to get the label, and it was due to start in May 2026. But just in the last couple of months, the start date has been pushed out to September 2028. So we hope that the label will still come into force and that it won't be either pushed out further or repealed. But it is the first country, and so obviously it's a really rich possibility for studying these labels in terms of their impact. There are a number of other countries that are also contemplating cancer and alcohol labels. There's a private members bill before the Canadian Parliament. The UK, or specifically England, is looking at cancer and alcohol labels as part of its National Health Service 10-year plan. So this is something to watch going forward, we think, and we've got a number of studies, like Simone mentioned, that are looking at this issue about alcohol and cancer labeling. There's just one more that I wanted to leave you with, and it's around family violence. And these are the labels that Thailand proposed in 2010. So we're looking at 15 years ago. And I know they're not it's not a great version, but the bottom middle label was actually to be about alcohol and family violence. You can see that it looks like there's an adult about to hit a child in that bottom image. The bottom one on the right, there's also a person drinking. I'm sorry, it's a very bad reproduction, but it's about alcohol being a bad influence on minors. So alcohol, adults drinking and being a bad influence on minors. And this label about family violence, this is the only time I've ever seen this suggested. The Thailand labels did not proceed, and partly due to international pressure on Thailand through the World Trade Organization about this issue. But it's an interesting, I think, idea to bring back, particularly in the context where the Commonwealth government has finally recognised a link between alcohol consumption and family violence. And so this is in a number of Commonwealth policies now. And it's certainly a consideration that the Australian Communications and Media Authority took into account when deciding not to approve the industry code for broadcasting and alcohol advertising. So, is this where we're going in the future? So just leave you with that as part of something to think about, and maybe something that will get raised in the discussion. So thank you very much. Thanks everyone for being here.
I am going to bring this very interesting seminar to a close. It's been fantastic to have this deep dive into a very complex issue that has to do with food monitoring and regulation and public health and international standards and trade and politics. And there's just so many different threads that you can pull on. So I think it's a terrific example of, I guess, interdisciplinary research that where the whole is so much greater than the sum of all of its parts. Sorry to be a bit of a cliche. But thank you, Paula and Simone and everyone for coming. And there's information in the chat to join the mailing list. So thank you.
Thanks, everybody. Bye.